Hi everyone, my name's Hillary. I'm with Unbound Medicine and I'm here today to give you a brief tutorial on your uCentral. uCentral is a collection of resources and tools that can be downloaded to your mobile devices and used on the web. Once downloaded, you will not need an internet connection. uCentral will provide you with all of the necessary tools to answer questions in the lab, classroom, and clinical settings. So let's begin. Today I'm demonstrating on an iPad, but remember that this can also be downloaded to iPhones and Android phones and tablets. The first thing to know is that support is available Monday through Friday from 9 to 5. You can call, email, or chat. Now let's dig into what's available. Across the top, you'll notice several icons. Some are for resources, others are for tools. First, we'll focus on the resources. Davis's drug guide has more than 5,000 drug entries. It's regularly updated, which ensures you always have the latest drug information. Davis's drug guide has been a top resource for over 30 years. We're going to do a quick search for warfarin. Here you can see this is a high alert medication. There's a pronunciation, full color photos, and vital drug information. Need to make a dosage calculation? The calculator icon will take you right to integrated calculators. Davis's Lab and Diagnostic Tests helps you understand and interpret the normal and abnormal results. Nurse's Pocket Guide helps you make accurate nursing diagnoses and to develop effective care plans. It includes bolded rationales, NANDA-approved definitions, related factors, defining characteristics, prioritized actions, interventions, and more. RNotes is often referred to as the nurse's clinical survival guide. It's practical, quick-find information on things like lab values, OD antidotes, CPR techniques, insulin regimens, and much more. RNotes has an emphasis on symptom and patient presentation rather than medical diagnosis. It includes charts and images, acronym abbreviation pop-ups, and Nclex badges denoting important exam areas of knowledge. Nclex Rn-Quest is another great study tool from Unbound Medicine. No internet connection is necessary, so students can study on the go. These other icons are for tools. Favorites, you'll notice in the lower left-hand corner of my screen, is a way to save and organize important records. Notes allows you to create custom notes and highlights. Integrated calculators allows you to double-check dosing, IV rates, or calculate important conversions. Prime PubMed gives you access to the full PubMed database, and you can keep track of nursing journals and find the articles you need for research papers in Prime journals. And finally, Grasp, our mobile study card system, allows you to build, study, and share flashcards. I'll show you how to use some of these tools and a few others in just a few moments. In order to show you how these resources and tools fit together, let's say you need to put together a concept map or a care plan and you need to do a little more investigation on hypertension. Let's start with Nurse's Pocket Guide. In Nurse's Pocket Guide, we can use the Jump To menu to search for hypertension. This search will search just within this resource. We'll choose Risk for Activity and Tolerance, and from there we can see the related factors, defining characteristics, and nursing priorities. The defining characteristics in this resource are presented subjectively and objectively. The actions and interventions are organized by nursing priority. Throughout, you'll also notice icons for cultural, collaborative, community home care, diagnostic studies, pediatric, geriatric lifespan, and medications. If we find something important that we'd like to refer back to later, we can take a note. Highlighter options are available in pink, green, and yellow. For our purposes, we'll just write test, tap done, and then go to the home screen where the note is waiting for us. To get back into our resource, we tap on the note. Let's do a general search for hypertension and see what we can find. The search in the universal search bar will search across all resources. Here we notice options for Davis's Lab and Diagnostic Tests, Nurse's Pocket Guide, RNotes, and at the bottom, Davis's Drug Guide. Let's choose Davis's Drug Guide. Here we can look for the indications and contraindications. Again, calculators are available to us, as well as patient teaching information. Let's say we want to save this to refer back to later. By tapping the star in the lower right-hand corner of my screen, I've now favorited that item. Going back to the home page, the item is waiting for me. And just like with a note, tapping that favorite brings me right back to the record I was in. Let's go back to our general search and check out some of the other resources. This time, let's choose Davis's Lab and Diagnostic Tests, where once again, we can find the normal and abnormal results. From here, we can use crosslinks to find even more information. Crosslinks are the two arrows facing in opposite directions at the bottom of my screen. The first item tells us there's more information in a Prime PubMed search. Again, Prime PubMed searches the entire PubMed database and provides evidence-based information. Let's quickly check in with RNotes. Here we have clinical findings, pop-up definitions, and a collaborative management checklist. Let's take a closer look at Nclex Rn-Quest. In Nclex Rn-Quest, questions are organized by client needs areas as defined by NCSBN. Curriculum-specific questions in pharmacology, assessment, anatomy and physiology, etc. And cognitive level questions. Let's take a look at a quick quiz. A quick quiz asks you to answer questions. You can pause your quiz at any time to see your progress and review any answers. A quick study works like a practice test, where you see rationales to your answers immediately after answering each question. In addition, hints are available, as well as crosslinks. The questions in Nclex Rn-Quest are drawn randomly from the database. You can set goals, review missed questions, and use it anywhere. No internet connection is needed. Let's take a quick look at the web. As I said at the beginning, you have access to all of this on the web. Anything you do on your mobile devices will be saved on the web and vice versa. Here's the home screen. The icons are the same. Favorites is located on the top taskbar and also to the right of the screen. You'll notice that all of our favorites are saved from the app and waiting for you on the web. Our note is seamlessly saved as well. When we tap on that note, we're taken right to the entry just as we were in the app. Here we'll do a quick search for hypertension in the universal search bar. Just as in the app, a number of options populate the screen. When we open a resource, the sections menu is located to the left, and cross-links and related topics are open to the right. There are options to print, search within this resource, make a grasp deck, cite this source for a research paper, print this item, favorite this item, or tag this item. Tagging is a way to organize your favorites. You can find information on making grasp study decks and how to use our other tools under How to Unbound on our YouTube channel. And that's the web version. All of your information stays the same in your account, and it's just as easy to navigate. Please remember, if you have any questions, reach out to us. We're happy to help.